Hi everybody, I'm Dr. Andrea Orvieto from Sofla Acupuncture and Wellness, and today is my last video on the series of different chemicals and toxins that can affect our overall health and well-being, our hormone health, our thyroid health, if you're trying to conceive, our fertility health, if you're having difficulty especially, and if you're pregnant, how to protect that baby that we are growing and how to protect yourself during pregnancy. We've spoken about different chemicals found in plastics. We've spoken about different chemicals found in our cosmetic products. We've spoken about pesticides and chemicals found in nonstick cookware and aluminum. And today we're going to speak about mercury and some other different chemicals that are found in our day-to-day lives. So mercury, we know to avoid as much as possible. It's non-toxic. It is toxic. It's a neurotoxin. In addition to that, it crosses the placenta if you are pregnant. So why put it in our bodies if it can cause harm to ourselves and to our future child? So there's certain things that you may not be able to avoid. And we know that there are certain fish that have higher levels of mercury. So how to limit your exposure is avoid swordfish, shark, mackerel. In addition to that, we know that tuna, there's a high mercury content found in tuna. So limit your tuna intake to about 6 ounces per week. Or you can find tuna that has very little mercury in it. There are now a lot on the market. In addition to that, for those that need to have dental work, especially if you're pregnant, and if you're not pregnant, certain fillings for cavities have aluminum in it. So see if your dental office offers other options for that. To know and educate yourself and see. It's always great to question and ask before doing something that may not be great for you for you specifically. In addition, if you are choosing to get vaccinated during pregnancy, again, this is not an anti or pro-vaccine conversation. There are vaccinations that don't contain mercury, and there are vaccinations that do. So see what your options are. Just be aware and educated and ask those questions. You have the right to do so. So some other chemicals that you should avoid in addition to that are going to be heavy metals, formaldehyde, flame retardants, antibacterial chemicals that are found. Flame retardants are known to be associated with disrupting the thyroid hormone levels. In addition, antibacterial chemicals can also do that. And we want to avoid that as much as possible, especially if trying to get pregnant is what you want. And it's just good for your overall health and well-being, especially that we have products that do a wonderful job that are non-toxic. So how do you avoid being around these chemicals as much as possible? Don't smoke, first and foremost, and try to avoid secondhand smoke as well. Use a high-quality water filter. There are a lot of options out on the market. Do a little bit of research, and maybe I can share some suggestions in the future as well. Choose furniture without flame retardants. In addition to that, wash your hands frequently. It's to wash out any virus, bacteria. Just regular soap and water is really great and non-toxic specifically. Clean your house with a vacuum that has a HEPA filter to help clean the air quality, and just overall your rugs if you have, or carpets and also your furniture as well. Swap out cleaning products for healthier options. You can use water and vinegar for most of your cleaning needs. There are also some really, really great products out on the market that if you want something that you feel a little bit more comfortable using, I will share the ones that I use in my house and also my office, which both are non-toxic. And also avoid antibacterial products that are full of chemicals. Read the labels, such as hand sanitizers or soaps, hand gels, and toothpastes as well. And last, which we spoke about before, is cook with appropriate high-quality pots and pans. Ceramic, cast iron. There's so many to choose from, and there's so many great options that are also affordable. So if you have any questions about any of the series that I've spoken about, or want to reach out to inquire about specific products that maybe I use that I can suggest for you, please don't hesitate. I hope to see you in the clinic soon. Have a great day.